When we think about luminal breast cancer, we're really talking about estrogen receptor positive breast cancer. In the metastatic setting, we don't make a distinction between luminal A and luminal B in terms of how we choose our treatments. We really think about these together as potentially estrogen responsive tumors, and the mainstay of treatment in those patients who have advanced disease is using an anti-estrogen. However, because resistance is so common, we've now developed ways to try to get around that by adding additional therapies. And the two categories of treatment that really have now come into the mainstream and standard of care, the addition of mTOR inhibitors and CDK4/6 inhibitors. And so I think within the last 5 years, we have seen now the FDA approval of numerous drugs, everolimus that blocks mTOR, to the CDK4/6 inhibitors, palbociclib, ribociclib, and abemaciclib. And these drugs overall, when added to an anti-estrogen in the metastatic setting, provide an enormous benefit. In fact, will double the length of time that patients can respond to an anti-estrogen therapy. And so what's happening is these agents are essentially delaying or preventing the resistance that would have typically occurred. And this is due to a lot of crosstalk between estrogen receptor pathways and these other pathways. So now by targeting these pathways, we can keep patients on endocrine therapy longer. The other benefit of these therapies is that they're very well tolerated. They're oral, and they don't have the same types of side effects that chemotherapy has. So patients don't lose their hair, they don't tend to get as sick, they don't tend to get infections. But there are some side effects, and we've learned how to manage those. And I think this has really been a tremendous advance for women with ER-positive metastatic breast cancer who now can stay on oral therapies, often for many years, with great disease control, and be able to put off needing chemotherapy. In general, we think that if you're taking a medication for metastatic breast cancer, patients are highly motivated to stay on that medication because, of course, without it, the cancer will grow. However, it turns out that there are issues with adherence even in that setting, and many times those issues really are not related to motivation of patients, but really to issues of feasibility. So if patients are having side effects, they may say, oh, maybe I'll skip my dose today because then my side effects will decrease. Or sometimes it's difficult to pay for these medications, and patients will run out and have a gap before they can afford to refill their prescription. So these are issues that require us to be very vigilant in helping patients stay on their medications, and also to understand the importance of not changing the dose or the schedule, because by decreasing the dosing or the schedule, by skipping doses or having the dose, may really lose the effectiveness of the treatment.